Welcome. My name is Anna Rouse and I will be presenting The Young and the Healthy, a DNP-guided primary prevention program for young adults on sexually transmitted diseases. This is the table of contents for the following presentation. First, we will discuss what STDs are. STD stands for sexually transmitted disease, and STI stands for sexually transmitted infection. The terms are interchangeable and will be used as such for the remainder of the presentation. STIs are diseases or infections that are passed from one person to another through various forms of sexual intercourse or contact. Not all have symptoms. The three most common are chlamydia, gonorrhea, and syphilis. We will briefly discuss these three as they are pertinent when considering our population. Chlamydia is the most common sexually transmitted disease. The parasitic bacterium can infect various orifices of both males and females. It's often asymptomatic but can cause mild to severe symptoms listed in the table shown. Untreated chlamydia can result in various complications, and those who have had it and been treated for chlamydia may be reinfected. Gonorrhea is a bacteria that can infect the oral cavity, genital tract, or rectum of both males and females. It's often mistaken for a urinary tract infection by females because the signs and symptoms are very similar. Men generally have more symptoms when they are infected with gonorrhea. Gonorrhea is treated with oral antibiotics, but there is growing concern about the increase in drug-resistant forms of gonorrhea. The last sexually transmitted infection I will cover is syphilis. It's caused by a bacteria that can infect the genitals, lips, mouth, or anus of human beings. It can be passed by sexual activity or from a mother to her baby in utero. The signs and symptoms that those who are infected with syphilis experience define what stage the disease is in. The signs and stages are listed in the table shown. The disease can be cured with the antibiotic penicillin, but if left untreated can affect all organs in the body. These are the most common symptoms of the STDs covered. It is important to be aware of them so that we can educate the population on STIs and what to look for. Education is key to the prevention of STDs. By encouraging recommended testing, conversations prior to sexual activity, and the limitation of partners, we can better equip populations to avoid STDs. Drug and alcohol use also contribute to the risk of STIs and should be discouraged. Providing resources for those in need to further educate themselves also proves beneficial. Here are some statistics on STIs in the young adult population. For this presentation's purpose, young adult or adolescents include males and females between 15 and 24 years of age. 1 in 5 individuals in the United States has an STD in their lifetime. Of the 26 million newly diagnosed STDs reported to the CDC in 2018, almost half were people between the age of 15 and 24 years old. STD prevalence in the United States only continues to rise. The CDC states that education, service availability, and support are vital to preventing STDs in young adults. We will now discuss what risk factors affect the young adult population. Statistics show that 15 to 24-year-olds are the most at-risk population, and there are various reasons why. This age is considered vulnerable due to rapid changes in their behavioral, cognitive, emotional, and social development. They have less access to testing and treatment due to insurance and transportation problems. Young women are also more prone to sexually transmitted infections biologically. Young people tend to have more than one sexual partner and are less likely to ask about their partner's history. They are generally not open to discuss sexual activity because of discomfort. Due to STD prevalence amongst 15 to 24-year-olds, the CDC recommends that all sexually active people under the age of 25 be screened for STIs yearly. Now we will discuss the Young and the Healthy program. Inspired by the CDC's educational efforts, the program's purpose is primary prevention methods of sexually transmitted infections, concentrating on the education of young adults in the United States about the risk of sexually transmitted diseases and how to reduce their prevalence rates among this age. The Young and the Healthy will be implemented in participating Alabama high schools. This will ensure that the young adult population is targeted. A series of surveys will be given along with educational presentations in their health classes. Survey 1 will be given and collected at the beginning of class, followed by educational presentations. The second survey will be given, followed by a review of resources. The third survey will be given 1 week after the first and the second. The doctor and nurse practitioner will compare results from the first and third survey to assess the program. The program may be repeated 2 to 3 times a school year. A health teacher will give and collect the surveys. Nursing students from local programs will provide educational presentations, and the school nurse will educate the class on resources. The DNP will lead and assess the program. Now we will discuss surveys more in depth. Survey 1 and 2 will be given at the first part of the program on the first day. The first survey will be given prior to any education. It will be turned in immediately following completion and should take 5 minutes. The second survey will be given after educational presentations are held. It will be a self-assessment, and students will be assured that only they will grade and see their own results. It should take about 8 minutes. A short resource review will be given after the second survey. The third survey will be given 1 week after the first. It will be very similar in content to the first survey. This will analyze if education in the program was effective. It should take 10 minutes. Survey 1 will assess the knowledge of STDs prior to education. It may ask questions like, what are the most common STDs? When and where could you be tested for STDs? Survey 2 will be a self-assessment of the individual's risk of contracting STDs. It will ask questions that will expose their own personal risk to sexually transmitted infections. Some of the questions may be, are you sexually active? How many partners does your partner have? This should prompt students to seek resources. Survey 3 will assess if the student has grown in knowledge of STDs and resources available for treatment and testing. It will ask questions like, can you list one of the most common STDs? Can you list one of the resources available should you seek testing or treatment for an STD? Nursing students from local universities will provide the educational presentations. The nursing school staff can divide the students into 3 groups and give them the educational topics. The students should have 2 weeks to prepare. They will be expected to provide visual, tactile, and audible components in their education. They will verbally give the education over 3 to 5 minutes. They may use a poster or PowerPoint for a visual prompt, and they will be expected to provide a handout for a tactile prompt. By including the local nursing students, another group of predominantly young adults will be educated as they research and prepare. Group 1 will discuss what an STD is. Group 2 will discuss what are the 3 most common STIs and what are their signs and symptoms. Group 3 will discuss what the risk factors are for STDs and STIs. Following the second survey, the resource review will be held. This is where the health instructor or school nurse will create a handout to cover with the class. The handout should list available resources for STI testing and treatment. This slide lists a few facilities that provide free testing in Alabama. They may also mention resources to seek out if students want more reliable information on STDs. The Mayo Clinic and CDC are 2 examples. Preferably, some resources they list will be local to their student group. They should also offer to be a resource themselves, ensuring students that they will listen and refer them to the correct place to get help that they need. Now we'll discuss a few suggestions for those providing education in the Young and the Healthy program. The lead DNP may want to send this in an email or a flyer to help the health teachers, nursing students, and school nurses prepare for potential conversations with students. Those dealing with students who want to discuss STIs should examine personal bias, make no assumption, and they should not react to any statement made by the students. The educator should establish a rapport and a respect with the student. They may ask what the student's preferred pronoun is, and they may use neutral terms such as partner when discussing the student's relationship. STDs are a sensitive topic, especially when they are discussed with someone like an authority figure. If students seem offended or reluctant to answer, rephrase whatever question caused the discomfort. Try to normalize the topic you are discussing and avoid using medical jargon that the student may not understand. Attempt to be approachable. Create the most relaxed environment possible by making yourself eye level with the patient and maintaining a neutral position. If students want help assessing their risk factors for STDs or need for personal testing, you can ask them the following questions. There are more tasks for the DNP in the Young and Healthy program than can be listed. DNPs have the skill and knowledge to collect and analyze data. They also possess the leadership skills to guide a program involving various groups like this. They will delegate and guide the following in their task. This is a list of roles the DNP will play in the Young and the Healthy program. They will educate, recruit, delegate, develop, evaluate, and lead. The following leadership competencies will be required from the DNP as a lead in the Young and the Healthy program. They will provide project management as they organize and delegate within the program. They will practice communication as they collaborate and educate various groups. And they will promote change as they interchange between roles themselves. The program will be evaluated by the DNP in many ways. The first and the third survey will be compared, and they may also consult the school nurse and staff to assess for change if students have sought their resources. The goal of the program is a 30% increase in test scores after the nursing students' presentations are given. All students are able to identify 2 of the most common signs and symptoms of STDs, and all students can list 1 resource or facility where they could seek testing or treatment. In summary, STDs are a leading health complication for young adults. Young adults frequently lack education on the subject and are unaware of their personal risk factors. By implementing early education on STDs, the resources needed to treat and test for them, the DNP can ensure that all young adults that receive the teaching are aware of how to prevent these diseases. This will potentially result in a decrease in STDs, decrease in spread of STDs, and or an increase in the number of existing STDs that are effectively treated. This will result in healthier young people at less risk for serious complications due to STDs, therefore leading healthier lifestyles.